Hello, what is going on, people? Hope you're doing well during these weird times. The quarantine life, I treat you well. Um, Today we're gonna do another Otis tutorial video, and it's probably gonna be the last one, probably because the license expires today. So suppose it's gonna be 12 a.m. tomorrow. So let's enjoy this. And today we're gonna do a exercise that was given by our uni before the final exam. So it's supposed to be like a mock test, or I don't know, just something close to the final exam. And also it's a level 7. So I think it'll be fairly difficult. Although I've like totally forgotten what was the audiogram like in this case, because we've done so many cases. And yeah, all right, let's get started. Like, first thing first, you have to type in your name. Yeah, it's taking a while to start. Okay, so Mrs. Charlene Donaldson is 40 years old. So CD is a waitress in a nightclub for the last 3 to 4 years. Her husband reports a decrease in Charlene's hearing ability over the last few months. He feels her left ear is worse than her right. I don't get it. What does that mean? Like, he feels? Shouldn't it be like she feels? But yeah, whatever. Charlene also asked for more repeats when driving. Okay, so let's jump right to the case. First thing first, we need to ask the patient which ear is the better ear. So the patient reports like the right ear is better ear. And we take a look at the otoscopy. I would say both ears are normal, and although there's like a little bit of discoloration here in the left ear, but TM is basically a layer of skin, and there could be different pigment or color on your skin. So I would say that's pretty much normal so far. And we look at the case history. So the patient has reported occasional fullness, more seal in the left ear. I don't even know what more seal is. Oh, I think it's like more so in the left ear, whatever. Jeez, they don't really care about the spelling, which does not clear with Valsalva maneuver. Well, Valsalva maneuver is when you pinch your nose and you try to blow, and then it kind of like pops your ear. Like when you get off the plane or you get off the elevator that was moving really fast. That's how you pop your ear or like just equalize the air pressure within your sinus or your inner ear, not like inner ear, but like middle ear. Anyway, you try to blow open the eustachian tube to equalize. That's Valsalva maneuver. Anyway, so no tinnitus, family history, surgery, or oral pain like pain in ear. Slight lightheadedness when getting up. Well, I have that too. It's like head rush. You're like super hungry or you stand up too quick. No nausea or vomiting. Okay, cool. And Charlene's not overly concerned. Well, you should be concerned, I think, right? All right. Okay. So let's check out the paper test is lateralized to the right side. Here to the right side. So either it means, well, it just basically means that the worse ear or the poorer ear has a sensorineural hearing loss. And the reading test is positive to the right ear and positive for the left ear. Cool. So that means it's basically conductive. Because if it's it's basically sensorineural. Because if it's conductive, then it should be negative reading test. Anyway, it's just a standard test battery. Cool. Now let's get started. We will test the right ear first for the AC threshold. Have you forgotten to switch on the best tone? What does it mean? To present this test. Oh, Yeah, all right, never mind, because it wants me to start with 40. That's just stupid. Start with 50. Start with 100 if you want. You're the audiologist. You do whatever you want, right? Okay. That was not true, right? You don't want to blast your patient unless it's not a real patient. So you can just blast the, out of the patient. So that was our first ascending at 5 dB. Also, we had a first ascending at 10 dB. Because we had second ascending at 5 dB, so that is our threshold. Was that second ascending? I can't remember, but whatever. Should be accurate. My LCD is telling me to go back and retest. So yeah, I will retest 4K. LCD is really not good for you. Anyway, we have to retest 1K for the first year that we test, just to make sure that the patient understands that what is going on. Because sometimes it could be really, really, really silly. Yeah, just kidding. They're not silly. Yes, they are. Okay. Yeah, your hearing is fine. Stop wasting that time. Oh, I remember I said exactly the same thing when I first, when I was first doing this case. Okay, hearing is fine. Stop wasting the time. Was that second ascending already? I don't know. Yeah, definitely nowadays. See, I'm smashing my keyboard. That doesn't mean you can do the same thing in clinic, right? You might want to be quiet. But some clinic do have a soundproof booth. So just put them in there and close the door and send them to the outer space. Now we're testing the left ear. I'll probably start with 40 again. Come on, hearing's, I want to say hearing's all right, but so far it's pretty good. Is second ascending already? I think so. Oh, how this drop. I just hope there's no 20 dB gap, otherwise I have to test 1.5K. Yeah, whatever, okay. Now because there's 20 dB gap between the two frequencies, I have to do inner octave frequency, which is 1.5K. Take me like a couple more seconds. But still it's annoying. Yeah, that was our second ascending. Oh, come on, your hearing is, no, I wouldn't say it's all right, because there's definitely a hearing loss. Cool. So first ascending at 15 hertz, for 15 dB. And we've got our second ascending, and then we're gonna test the BC. I'll start with right ear because right ear is better ear. But apparently some unis tell you to start, like the order of testing is better ear AC, poor ear BC. I'm sorry, better ear AC, poor ear AC, and then poor ear BC, better ear AC. then we were told to test better year AC, BC. So like better year AC, poor year AC, better year BC, poor year BC. I don't think the order changed a lot, or like it's gonna affect your final result. It can be like fairly flexible, but there are cases that you have to test something first and then another thing. For example, when you think there might be a risk of over masking, I can't really think of a scenario that you have to change the uh, specific order or test what first. But yeah, just saying. If I'm making any sense, I don't know. I'm super hungry at the moment. And now 7:28 p.m. I'm supposed to eat, but I have to finish this first. Why? Because it's expiring in 5 hours. Now, because theoretically the AC shouldn't be worse than, sorry, the BC threshold shouldn't be worse than the AC threshold, but now it's only 5 dB, so we're not really concerned. But if it's more than 10 dB, let's say 15, 20 dB, then, well, you might need to do the following. First thing first, you re-instruct the client, because apparently there's smarter people in the world. Well, they're not the smarter people in the world. And then you might want to check the placement of your basic conductor, right? It might just, slip to behind the mastoid, or yeah, just recheck. And you might want to listen, do a biological check to see if it's actually vibrating right, but you can't really calibrate anything at this stage testing, because you're in the middle of PTA test. That's something you can do, but 5 dB below the threshold, I'm not really concerned. It happens all the time, not all the time, but quite often. That's our second ascending. So got the threshold at 2K. Whoa, what's going on here? Now, some clinics does do test 3K and 6K. I mean AC for AC. Mainly because if they are OHS patients, OHS does require you to test 3K, at least 3K, I think, but also 6K. So it varies between different clinics. Now I'm not testing 3K and 6K because for the sake of final exams, you don't have to test 3K or 6K unless they require you to do so. Then you do whatever they ask you to do, right? Because you want to pass. Okay, so we finished the AC threshold here, and then we check if there's 40 dB airborne gap, so we have to mask. Here is 5 to 35, which 30, no need to mask. 0 to 35, great, no need to mask. Here 10 to 40, because there's no BC threshold for your reference, then you use just a gap, which is air gap. And also there's no more than 40 dB, so we'd have to mask the left ear AC threshold, which is great. Now, next thing, we have to mask BC for left ear, because apparently there's more than 10 dB gap. Now let's do mask, and then we're testing left ear. So the masking noise is presented to the right ear. We only have to do 2K and 4K, right? Yeah, right. Okay. Now I'm applying my 10-10 technique, which is the masker should be 10 dB louder than the non-test ear AC threshold, and the signal, the BC signal, should be 10 dB louder than the outmasked BC threshold. It's just my thing, and I think it works pretty well. Wait, okay. So masker should be presented to the right ear. Now we have to reestablish the threshold. Why? Because of the occlusion effect. And then why occlusion effect requires you to reestablish the threshold? I have no idea. I had some ideas and I forgot. Yep, we will get 30 dB plateau. Cool. So that was our left ear threshold, BC threshold, the real or the accurate threshold after masking. And we turn off the masker, we move on to the next threshold or next frequency, and we turn on the mask again, and we apply the 10-10 technique. We start to re-establish the threshold. Obviously, that's probably the threshold, but it's definitely not the real threshold, so I'm not gonna test that many times. Wait, what have I done? No. Yeah, okay. So we try the first 10 dB plateau, there was nothing, so we have to increase the signal level to 30 dB. And okay, first 10 dB plateau, 20 dB plateau. Now let's pray. Please respond. Great. Okay, so we finished everything basically, right? We've had our mask AC threshold for both ears, and we checked the 40 dB gap to see if we need to mask any AC threshold. It turned out we didn't have to, but we did need to mask the BC for both ears here, not both ear, but like left ear at 2K and 4K. And because the bone conduction threshold here at 1K, the unmasked BC threshold is at 5, not 0. So I don't actually need to mask the BC threshold for the left ear at 1K, which is great. I was complaining about that because it's out of like it's louder, or like threshold is lower than the AC threshold, which is theoretically shouldn't be, but in reality, yeah, of course, that could be the case. Okay, so I finished everything. So I just turn off the masker so we don't blast the patient, because the masking level is pretty high. You know, it's 60 dB, and yeah, it's pretty high. Okay, we're finished. Well, it turns out this level is not too difficult, I would say. As you said, it's level 7. Well, we have like had level 7 in the last video. That one was so messy, and I made a mistake. But this one, it's definitely not. It's definitely not as difficult as last one. And let's check out the error list. So wrong frequency, I have no idea what that mean. What that even mean? At unmasked AC right 4K hertz tested instead of 500 hertz. What does it even mean? Screw you. 1K hertz of unmasked AC right measure more than once. Oh, come on. I measure as many times as one. Whatever. Okay, let's check the accuracy and efficiency. It's 9 out of 10. I'm happy with that. And it's 10 out of 10, 10 out of 10. Awesome. Okay, that means the techniques we applied were basically correct, right? So we got pretty much the accurate results, and the patient is happy. I hope her husband is happy as well. So like if you want to explain to the patient, you would say, well, your right ear is normal. And one of the things I've seen a lot of CEs or a lot of audiologists have done is that they cover up whatever's below 20 with the like white sheet or anything. And then they explain to the patient, look, anything above that is normal. Anything below that is not normal. And the lower it is, that means greater the hearing loss is. So then, yeah, you do have a hearing loss, and we call it mild hearing loss. It's mainly above 1K hertz, and around 2K and 4K is where the speech sounds are mainly where the speech sounds are, right? So you might have some problems with the speech sometimes, but I wouldn't say the hearing is so great. And I don't think hearing aids should be you could, like, I wouldn't recommend hearing aids at this stage of time. So like the recommendation would be like, please take care of your hearing. If you're working as a waitress, a nightclub, you better take a break at this stage of time and use hearing protection. Reduce the duration of your noise exposure. Like if you're working like 7 hours a day in this noisy environment, that's definitely gonna, screw your ears up. So you better reduce the working length, right? And then please monitor hearing, preferably every year, and preferably at my clinic. Yeah, okay. So that's basically everything you want to do in this case. So it's a fairly easy case. I'm happy. I'll probably do another one before it expires. And again, thanks for watching. Good luck with everything. Good luck with your uni. Good luck with not catching the virus. And I'll see you guys in the next one, hopefully. Bye-bye.